position are to urinate, and most of the people having the kidney stone, they have the cloudy or smelly urine, feeling of the being sick, or if you have the infection accompanied by the kidney stone, then you may have the fever and the chills too. Now I show you picture of some person who have the kidney stone failed. Don't worry. Everything is worried. Who is coming? Other people should not laugh. I am here still. Okay, come to point. How are the kidney stone diagnosed?
Intermission.
First of all, for diagnosing the kidney stone, that either you have that or not. A good physician like me will prescribe you some blood test, some urine analysis, and after that, if you have the kidney stone, then we can take the
पानी पी ले सर.
then we can take the following test to locate where the kidney stone is present. Like first of all, we can take the X-ray image. Right here, I have this X-ray image. You can see. In this, we can see by taking X-ray image, we can take the image of the ureter, we can take the image of the bladder, we can take the image of the kidney tube. So we can locate where the kidney stone is present. Then comes the intravenous urogram. In this technique, we inject a dye called sorry, I forgot its name. We inject a dye in the vein. So it rotates in all our body. Its name is contrast material. This dye's name. It rotates all over body, and then we can take the image of all over the body, and if where the kidney stone is present, we can detect that. Then ultrasound scan. I think boys will never have, because mostly pregnant women, if they have the kidney stone, they have the ultrasound scan. Then abdominal CT scan. In this technique, a computer and a scanner is used for locating where the kidney stone is present. And even the new scanners are such like that we don't need to use any dyes, so they are most accurate. Then comes the abdominal kidney MRI, and last is the retrograde pyelogram. So some people have some allergic effect to the dyes. So for them, this technique, like some sensitive people like Mr. Harun, for them we inject dyes directly in the ureter, so that dyes have not to rotate all over the body. So the dyes is directly injected there, and we can take the image of the ureter, bladder, and the kidney, and we can look at where the kidney stone is present. For the rest of the presentation, I will call my dear friend, my brother Zakriya, come to stage, please.
सर बैठे.
Assalamu alaikum wa rahmatullahi wa barakatuh.
वालेकुम अस्सलाम.
Today in my role I will present for clinical side kidney stone treatment. How are kidney stone treated? Before kidney stone treated, the kidney stone treated is depends about the size and underlying cause, and also the infection of urinary tract. So before I treated the kidney, so that the first treatment, there is a 3 process or 4 process to treat, that we can treat kidney stone. First is home treatment. Home treatment, there is no any medication place, only you can treat in your home. The first is drink extra fluid. Drink extra fluid, it is drink more fluid per day to remove your kidney stone or to become your urine clear. About you must take 2 to 4 bottles per day, or 10 to 8 glasses per day. Use pain medicine. The use of pain medicine, you can take if you have got any kidney stone, you can take kidney stone medications with a prescription of doctor. Not all medications. It's only for aspirin, like aspirin. Don't be careful when you are drinking the medicine. Collect kidney stones and urine. The doctors will suggest the patients to collect the stones and urine in a container to containing to scan or to test that urea. If there is any stone or any kidney stone or if there are any infection. After that, second is the medication. Medicine to prevent the calcium stones. So that the calcium stone is in our brother Nafid told us the mostly is kidney stone formed in our body is 80% approximately. So that we can treat potassium citrate to potassium citrate. We can take that treatment. And second one, medicine to prevent uric acid stones. Uric acid stones, we can treat potassium citrate. All the medical stones, we can treat potassium citrate. It's the most common treatment of kidney stones is potassium citrate. And also we can treat sodium bicarbonate. Medicine to prevent cystine stone. Cystine stone is a waste product and approximately 1% of in our body kidney stone. So that we can treatment potassium citrate, potassium citrate, or we can also treat penicillamine to escape or to remove to become 2-acyl. The medicine prevent starfied stones. Starfied stones is infection stones. Also, we can say it's infection stones, so that we can treat directly all the infection stones. The treatment is for antibiotic, so that we can also treatment inhibitory urea. And the third one is surgery, open surgery. We can classify open surgery and percutaneous nephrolysotomy surgery. Open surgery this is direct surgery that we make into the stomach or the side of the body, and we go in directly into the kidney and we remove the stone directly from the kidney. Percutaneous nephrolysotomy, PCNL. Also, this is a small incision that we can make inside of the body. After that, when we make that incision, we insert an instrument called nephroscope. After that, we remove all the stones for that instrument, nephroscope. We will discuss later for detail. Don't worry.
Okay.
Other treatment. The other treatment. Extracorporeal shock wave lithotripsy. This is a shock wave that breaks the large stones into small fragments. After that, when all the stones they become fragments, they will go into the ureter, then urinary bladder, and then go on as a urine. Ureteroscope. This treatment, there is no any incision. It's only we use an instrument that we insert into the urethra, then into the bladder, and then ureter. We remove all the stones, fragment stones. Now we will discuss the extracorporeal shock wave lithotripsy. The most frequent treatment is extracorporeal shock that treat in kidney stones. It cannot break the stones that is more than 3 centimeters in diameter, so that only we can break down the smallest stones. And the patient is positioned on water cushion. And also this process we are using ultrasound X-ray to break the large stones into small particles. After that, all the stones they will go into the urinary tract. After that, they will go as a kidney, as a ureter. This treatment, the recovery time is relatively short. The healing time for the patient to become remission or remission time is less. It's short time. Now you can see this is a large stone that forms in kidney. So that this is not possible to pass in the ureter. So that we need to make extra or ultrasound shock waves. After that, we use this. Everyone you see this. We use the ultrasound and ultrasound waves, so that all the large stones they become big and they go in direct into the ureter. This the 30 picture. Check all go in there as a urethra. They pass into the body and in the urine. Percutaneous nephrolysotomy is a treatment used when the stone is large.